Alright guys, it's Dr. Mohammed. So in our last video we talked about some ethical principles and some of the things that you need to keep in mind before you even start talking to patients. Now we're going to move on to the next step in that stage. You're going to be talking to patients. We're going to determine if they have the capacity to agree to medical decisions and if they are able to consent to medical decisions and medical treatments, okay? And this is all going to start with decision-making capacity. And decision-making capacity is basically ensuring that a patient is psychologically and legally capable of making healthcare decisions. There's four important components to decision-making capacity, and that's going to be understanding, appreciation, reasoning, and expressing a choice. And these kind of tie into those ethical principles that we talked about before. It has to be a choice for the patient. It has to be their autonomy, going back to those ethical principles. Some important things to know here is that decisions made with capacity cannot later be revoked if the patient loses capacity. So if the patient says when they're awake, alert, and talking around, I do not want to be intubated by any means necessary, if that patient becomes critically ill and they need to be intubated, they lost capacity, but you have to respect what they said and you would not intubate that patient. Another important caveat with decision-making capacity here is that intellectual disability and mental illness are not exclusions. So, for example, if you have a patient with Down syndrome, just because they have an intellectual disability does not mean that they do not have decision-making capacity in certain situations. The other side of that, an example, is a patient that's diagnosed with depression. Just because they have a mental illness does not mean that they do not have decision-making capacity. Of course, you as the physician need to determine that using those components that were discussed above, but they can still have decision-making capacity. And a really common example of when this happens in the hospital is when a patient wants to leave. They want to leave against medical advice. You as the physician will need to make the determination that the patient has decision-making capacity. They understand the risks of going home against medical advice. And if they have decision-making capacity, then you have to let them leave. Another important thing to know here is that decision-making capacity is different from competency. Capacity is something that's determined by a physician for healthcare-related decisions. That's what capacity is. Competency, on the other hand, is something that's determined by a judge, and really for the most part has nothing to do with us. We're never going to determine competency in patients. We are only determining capacity, so you really need to know that difference. The next big thing to know here is informed consent, and the really important thing, that's why I put the high yield button here, this is a two-step process. Step one is that the patient discusses important information about a procedure or a treatment with a healthcare provider. That's the first step. The second step is that a patient makes their decision about their care. Going back to those ethical principles, this is the core of autonomy. Patients need to be able to make their own decisions. And I want to reiterate this again, informed consent is a process. It is not a document, it is not a signature, it is this process right here. And just like decision-making capacity had four components, informed consent also has four components. It's going to be capacity, which, look at that, we already just talked about, so you guys know what that one is. There has to be disclosure, which is disclosing important information, and this is huge, including the risks and benefits. You need to explain that information to the patient before you get informed consent. If you never did that, you can't say that you got informed consent, because that is one of the components, and you need all four of these to ensure that you're getting informed consent. So we have capacity, we have disclosure, the next one is going to be understanding. And this is basically the patient having the ability to understand what is being discussed. So really an important part of that is no medical jargon. You're breaking things down into easily understandable language, how you talk to a fifth grader, and making sure that they have understanding of that. And the last component to really have informed consent is going to be voluntariness, which is the patient agreeing voluntarily and free of manipulation. So when you're having this conversation, you can't tell them, I really think that you need to do this. It needs to be a voluntary decision. You just present the information to the patient and they make whatever decision they want to make based off of that. A really common example of this that people are going to be doing once you're working in the hospital is going to be a blood transfusion. Me personally, the way that I go through a blood transfusion and I get informed consent from patients, we need to go through all of these things. First of all, you've made sure that the patient has decision-making capacity, so you check that box. You need to disclose everything about the procedure, so it would involve putting in an IV. We're going to be transfusing a blood product into your body, packed with blood cells. The benefits of this is it's going to improve the hemoglobin, and you need to explain what a hemoglobin is. You can't just leave it at that medical jargon. It may help with some of the symptoms that you're having, such as fatigue or shortness of breath or those kinds of things. There are risks to having a blood transfusion that may include infection, you may develop a fever, you may develop shortness of breath. These are all of the things that need to be explained to the patient. They need to verbalize understanding. Of course, if they have any questions, they need to have an outlet to ask those questions, and then they voluntarily make the decision on their own. An important thing to note here is that there are some exceptions to informed consent. A patient can waive their right to informed consent, which, as crazy as it may seem, some patients do that. They will defer consent to their spouse or to another family member because they don't want to make those medical decisions. If a patient is legally incompetent, as determined by a judge, that is an exception to informed consent. And in emergency situations, that example that we talked about in the last video, if you remember, if a patient is critically ill, they need to be intubated. Obviously, that is an emergency situation. We cannot get informed consent in that scenario. And we'll actually talk a little bit more about what you would do in that case in one of the upcoming videos. The last thing that we need to talk about is consent for minors. For our purposes, a minor is going to be anyone that's under 18 years old. And if they're under 18 years old, then you need to get parental consent. Now, there are some exceptions to this, and this is high yield, so you definitely need to know this. There's 4 exceptions here. The first one is going to be if they're legally emancipated. What does that mean? That is if that person, that minor, is married, or they're self-supporting, or they're in the military. For example, I've had patients come into the ER, they're 17 years old, they're either married or they're living on their own in their own house away from their parents. Even though they're less than 18 years old, they are legally emancipated, so I don't need to involve their parents to get consent for procedures or anything like that. The next example of an exception for consent for minors is going to be anything involving contraception, sexually transmitted infections, or pregnancy. So, for example, if a 16-year-old patient comes into the hospital or comes into the clinic requesting contraception, you do not need to involve the parents for that either. That is one of those exceptions. You can prescribe them a contraceptive if that's what they desire, because they are able to consent to that. The third exception here is going to be anything having to do with substance use. So if a patient comes in intoxicated, you can just get their consent for treatment rather than needing to call their parents or their guardian, because it is also one of those exceptions. Then the last one here is for any type of emergency treatment. And a really common example of this is a blood transfusion. So something that I have seen on the boards is there's a patient whose family is Jehovah's Witness, and the child has a critically low hemoglobin, and they need a life-saving blood transfusion. But the parents, because of their religious beliefs, are declining that blood transfusion. They do not want to have that done. What do you as the physician do? Knowing this information now, this is an exception. You do not need the parents' consent for this life-saving treatment. So the answer in that case is actually to give the blood transfusion, even though that's not what the parents want. It is an emergency treatment for the minor, and you can go ahead and do that, and you are protected legally. The only other thing that I want to mention about this consent for minors is these last 3 points here. Some people like to call them sex, drugs, and rock and roll, and that's how they remember them. Sex being the contraception, sexually transmitted infections and pregnancy, drugs being the substance use, and rock and roll being the emergency treatment. So that may just be a helpful way to remember that. The last thing that I want to talk about is that even if you have a minor and you can't get consent from them, you always want to get assent. Let's go ahead and write that out. So what is assent? Assent is basically agreement from a patient who cannot give you consent, which is literally what a minor is. A common example of this is if a pediatric patient comes in with a laceration and you need to do a suture repair. Yes, you need to get consent from their parents, but you definitely need to get assent from that patient before you stick a needle in their body. Okay, so that's also an important thing to know. That's it for this video, and good luck studying.